If I sit all day but do nothing at all to counteract the stresses that are on my body and to counteract how stagnant my body is, you're gonna have low back pain. The number one thing that anyone can do when they do have an onset of lower back pain is, at the best of their ability, maintain normal everyday activities.
What is sciatic pain specifically?
Sciatica is a low back problem, not a leg problem. Hurt does not equal harm. Just because you feel pain does not mean an injury has occurred. If it is causing pain, if it is symptomatic, it should be addressed and can be fully resolved with the right rehab program without surgery.
What are some of the common underlying issues that can lead to low back pain?
A muscle will feel tight when it is weak. Load the muscle.
Dr. Grant Elliott has a master's degree in sports medicine and rehabilitation, as well as a doctorate in chiropractic. He's the founder and CEO of RehabFix, an online training program to help people around the world resolve their low back pain, disc herniations, and sciatica. According to the CDC, 40% of American adults experience back pain, including sciatic pain, within the last 3 months. This is obviously an epidemic issue, and it's growing in prevalence. What do you think is going on? Why are so many people experiencing back pain and sciatica pain today?
A combination of us not moving as much, but also the overwhelming prevalence of misinformation and misguidance within the overall healthcare system and within the societal narratives surrounding back pain that has instilled the beliefs that this is a disabling, incurable condition.
Yeah, so we've got psychological as one part, and also practical, physical things that we're doing and not doing.
100%.
It's creating this recipe of pain.
Both.
And I'm so grateful to have you here today, because we're going to unpack all this stuff and provide some powerful insights for everyone and some powerful tools that people can use for a lifetime. But first and foremost, let's start with your superhero origin story. All right, what got you into this field? What got you interested in health and fitness? And why did you focus your attention and energy on back pain and sciatic pain specifically?
That would start with my parents. I'm the youngest of 3 boys. They had all of us in all the sports growing up. We were always active. And once I started kind of getting into fitness myself, I had known I always wanted to be in something health related, a doctor of some kind. I didn't know exactly what that would be. But I was a competitive mountain bike racer in high school. I raced for 3-4 years. And I was getting scholarship opportunities for that. I was quite good, and I was getting good. I was getting better very quickly. And then my last season, the most important one, I started developing low back pain myself. And as many will resonate with, it just slowly came out of nowhere. It came on insidiously, which is the most common onset of low back pain, and didn't think anything of it until it started to notice it more and more and more and more until it started impacting my races. Well, at that point, once you progress through classes, your races become more intense for longer. So 2-hour races, all out like the whole time. My back started not being able to make it through the races, and I started getting off the trail, stretching out, getting back on the bike, trying to keep going. And as you can imagine, time is very important in a race. So I started slipping, bailing out of my races. Okay, what do I do? Well, went to see what I know now is a traditional old school chiropractor, not of quality. You gotta do x-rays first, your spine's crooked, you need to see me 3 times a week, and there's no end in sight. But I didn't know any better at the time, neither did my dad. And so I did that typical thing most people's experience. And wow, it didn't help. And so my races kept getting worse. So I quit racing, lost my scholarships. So I was like, all right, I guess I'll just hit the gym more. I'll just work out more because I don't have an outlet now. A couple years into working out, I saw an individual at the gym, and he was doing some cool like warm up, like mobility, activation type stuff. And I was like, that looks interesting. That intrigues me. So I approached him, struck up conversation, and realized he was a chiropractor too. And then the things that he was talking about and the things that he was doing, I was like, it does not seem at all like what my previous experience was. And so he invited me to come shadow him. I shadowed him, and he was doing rehab. He was teaching movement. He was doing soft tissue. He was doing all the types of things that I did not get in my experience. And so I thought to myself, this should be all of healthcare. Why did I not get this? I wish I had. My story could have been different. So even though my story begins with a bad experience with a chiropractor, I said, okay, because I'm exposed to what it should have been, I'm going to become a chiropractor to be the best one and ensure that more individuals can get the quality of care that they deserve. So that's what made me decide to be a chiropractor. So even going into college, I knew what I wanted to be. So now, how did I end up focusing 100% on low back pain? A little over halfway through school, I had the realization, so this would have been 2017. Yes, around 2017. I had the realization, I should start posting on social media. I should start some kind of growth. And I didn't know exactly what that meant, but I was very rehab focused, sports medicine focused, movement focused. And so I thought, okay, I'm just going to start sharing stretches, sharing information, sharing rehab, because I was really, really into rehab and being the best at that. So just started posting here and there, started getting views, started getting questions. And I thought, okay, I should continue this so that when I graduate and I go to a brick and mortar, that I have a portfolio, so to speak, so that when I'm engaging with individuals, networking, I can say, look at my page. It would provide an immediate snapshot of my mission, what I'm about, what I can provide, and it would be good for building authority and building a name for myself. That was the intention, was just purely to post a bunch, to have it as a portfolio. Well, me being a driven person in anything I do, and I am addicted to growth and improvement, as I started posting more and views got more and likes became more and followers became more, that became the focus of just how can I make my videos better? How can I post more? How can I gain more followers? And that became the game. So I went from posting once a week casually to, 2, 3. And then I heard a podcast where they're like, if you want to really grow, like just post every day, do it. And so this was a year before graduation. I said, all right, I'm going to post every day until I graduate, which was a year. Gained 100,000 followers that year. And then where this steered to low back pain was towards the end of that, once it was time to launch my business, really, I was starting to listen to more business mentors and those types of subjects. And I started to hear the concept of forming a niche and niching down, and whatever your audience is telling you, that's what you need to focus on. And at that time, I was posting everything. I was posting shoulder pain, neck pain, hip pain, foot pain, jaw pain, all types of things. And it was growing my channel. But I analyzed it. I said, what's my audience telling me? And all of my low back pain videos, my sciatica videos, my disc herniation videos, those are the ones that were always the most viewed. Those were the most questions I got. And that's just what I am absolutely killer at helping. So I went, okay, this is it. I stopped posting about everything. I started only posting about low back pain. And now we have over 3 million followers across our social media, #1 online low back program in the world. And this is all we do, and it's all we preach.
That's amazing. Such an amazing story, man. I love that. And again, just looking at the data, 40% of American adults having a low back problem of some sort in the last 3 months, that's like an exceptionally large amount of people, versus, again, they're all kind of mechanical. And we could talk about the mechanistic stuff and also the psychology and psychosomatic issues that can happen with all parts of our bodies. But there's something about the low back that is so prevalent and so, widespread today. What are some of the kind of common underlying issues that can lead to low back pain? Let's talk about some of these things, both mechanistic and also maybe some of the psychology behind it.
Understood. So what are the most common things that can lead someone to developing lower back pain? So one aspect that is unavoidable, age is a component, but I'm going to add a secondary phrase to this, okay? Which is naturally, as we get older, we develop more musculoskeletal pain, just generally speaking. That does not mean we have to. Age is just a number. If we take care of our bodies and we keep moving, that doesn't mean we have to. But just purely based on the evidence, we develop more musculoskeletal related complaints, low back pain being a primary one, naturally as we age. So that's one component, one category that's not necessarily a controllable factor. What are controllable factors? Controllable factors are what we do with our body, both from a movement standpoint and what we do from a nutrition standpoint at any aspect of our life. So the number one reason we can really develop any degree of musculoskeletal pain, but especially lower back pain, is not moving enough or doing movements that are not ideal for our situation. So a basic example would be if I sit all day but do nothing at all to counteract the stresses that are on my body and to counteract how stagnant my body is, as well as sleeping poorly, as well as eating poorly, having excess adipose tissue, all things that increase inflammation in my body, as well as having a poor belief system around pain and low back pain, that's someone you're going to have low back pain for sure. So it's a cumulative manifestation of all of these things that would drive someone to develop lower back pain. It's not ever just one thing. That's important to understand. 90% of lower back pain is deemed non-specific low back pain, meaning it cannot be traced to one specific injury or one specific thing or one specific cause. It is a multifactorial approach.
Okay, let's talk about some of those factors that can be involved. So you mentioned musculoskeletal issues. So muscle can be an issue, disc can be an issue, nerves. Let's talk about these different components.
Yep. So of that 90% non-specific, it's because it's a culmination of factors outside of that. So I had mentioned sleep, diet, stress, worry, all these things. But then from a tissue standpoint, it's going to be a combination of disc, muscle, joint. So that is 90% of back pain. I'm actually, you prompt a thought in my head. A lot of people with low back pain have been told or believe that it's from a strained muscle. And this, most of the time, could not be further from the truth. And here's why. Let's make it very simple. You're a fit guy. You've been involved with fitness for a very long time. You're aware of if you were to hurt a muscle in the gym. Just like if you're training, you're also damaging a muscle intentionally. You're breaking tissue down. You might be a little bit sore. It recovers within 4 to 7 days and you're good. So what is a muscle strain? A muscle strain is a little bit more of that. I'm training a muscle. I broke it down a little bit more. Okay, that's a muscle strain. Generally speaking, Shawn, muscles can recover like pretty well, right? Like you're in the gym. Okay, I did this little something too much, a little bit too heavy. All right, like your muscle can recover. Muscles don't remain broken down for months and months and months. That does not happen. So if someone has chronic lower back pain or sciatica, and they're being told, oh, your back hurts from a muscle strain, but they've had this for months and months, it does not take a muscle months and months and months to recover at all. From a physiological standpoint, that's not at all accurate. So people are misdiagnosed with that label all the time. Oh, low back strain, it's just a muscle, like rest it and you'll be fine. No, wrong diagnosis, wrong approach. Rest is only going to make that person worse. Rest almost always chronifies pain. Well documented, rest is not advised for lower back pain. Causes fear avoidance behaviors, delays recovery, makes people more fearful of movement, which further less movement. They move less. Now things get worse. They're more stiff. Now they decondition even more. They become more weak. It just cascades the direction that you do not want to go. So that is my thought when someone says, what comprises low back pain? Muscle, joint, disc. That's my tangent on muscle. Joints, the joints of the lower back, they're called zygomaticophyseal joints or facet joints. It's all the little ones that interconnect throughout the spine. Yes, these can become stiff and limited as we limit our movement. If someone is sitting most of the day, sitting is not the new smoking. Sitting is not the devil. Not moving enough to counteract that is. So if I'm sitting, my spine is in this current position. But if I don't take my spine out of this position and expose those joints in my lower back to all the ranges that they were meant to go through, then I'm going to develop joint pain. So let's use my shoulder as an example. If I never move my shoulder overhead, I never reach it up here, let's pretend I keep my shoulder to my side for months and months and months. Do you think it's going to be easy for me to then go overhead. No, I'm not exploring the range of motion that my shoulder was designed to go to. So then all of a sudden, my shoulder becomes stiffer. Now there's pain. Now it hurts to go into an overhead position. So that is sometimes an easy analogy for people to digest, or an easy comparison. The same thing for your lower back. Yeah. If the joints in my spine are meant to go in all these different directions, extreme ranges of motion, our spine can move a lot, but we don't take it to those ranges, then the same thing applies. Now it gets stiffer. Now it's difficult to go into those ranges, and now we have pain. Simply put, that's the issue with joint. With discs, okay, first and foremost, the term disc bulge, disc herniation, these are scary words, but they shouldn't be. Disc bulges and disc herniations are extremely common. If you look at the massive abundance of evidence, we know individuals 20 to 30 years old, 30% of them will have a disc bulge, no pain. Individuals 30 to 40, 40%, disc bulge, no pain. 40 to 50, 50% of them have disc bulges, no pain. Disc bulges could be considered a common and somewhat normal asymptomatic finding for us to have and experience in our lives. These are not scary things, but most of society is scared of that word because everyone's, brother and their mother has been told, oh, disc bulge herniation, you're done. Either this is it for life, you got to quit exercising, you got to quit your job, stop moving, or the only thing that will fix you is surgery. When in reality, an amazing study done in 2020 that was conducted over 280,000 individuals with lumbar disc herniations, 97% recovered without surgery. But on the flip side, how many people with lumbar disc herniations are being advised to get surgery? Probably 97%. So it's completely flipped. So disc bulges are common, somewhat normal, not somewhat, they are normal in normal society. If we took an MRI of everyone in this room right now, it would be completely expected for about half of us to have a disc bulge and not know it. That's expected. So I wanted to mention that as we move into this discussion, that is not a scary term. It is a common thing. Now, can acute disc bulges and herniations occur and result in pain and suffering? Absolutely. The most common presentation of this typically is someone who is either lifting something off the ground, maybe squatting or deadlifting heavy, maybe just sneezing, maybe picking their child off the floor, maybe turning the wrong way, feeling a pop in the lower back, followed by significant stiffness, usually very difficult to stand up straight the next day. Some people describe the sensation, I had to crawl to the bathroom because I just couldn't stand up straight. And now they're experiencing a lot of low back pain or radiation down the leg if the bulge is hitting a nerve. So the mechanism there is, imagine there's an outer ring and then an inner fluid. So the outer ring of a disc is called the annulus fibrosus. It's a tough ring. It's what keeps the fluid in the middle. The fluid in the middle is called the nucleus pulposus. When that outer layer begins to become compromised or weakened or tear, the inner fluid bulges out or pushes the outer ring further, creating a bulge, which can then impact sensitive tissue or the nerve, thus creating the pain. But once again, these things can be seen on MRI and have no problem, no issue at all, and do not need to be addressed. Other issues, if it is causing pain, if it is symptomatic, it should be addressed and can be fully resolved with the right rehab program without surgery.
Phenomenal. Thank you so much, man. That's just amazing. This is like a masterclass on this stuff. And just thinking about standard of care right now for these issues, I was actually going to share, this study was from over 10 years ago, and this was published in the journal Clinical Rehabilitation, found that up to 97% of various forms of disc injuries had significant improvements without invasive treatments. As a matter of fact, one subset of sequestered disc injuries showed complete resolution of the injury 43% of the time without invasive procedures. But as you mentioned, the standard of care is stop mobilization, right? Stop movement and medication, and also become a candidate for surgery. And what you're sharing is so enlightening, which is essentially saying one of the worst things that you can do is to immobilize yourself. And yet that's the thing that we're often recommended. And I know this firsthand, when I was a kid, when I was 20 years old and dealing with disc issues, I was given a permission slip, basically. I was given bed rest, right? And I had like a little note to give to my job. Like the doctor gave me bed rest. I can't do anything. And so that just went on and on. I see another doctor, they give me another note for bed rest, and it wasn't just my spine and all the muscles atrophying, like the rest of my body was atrophying because as you're sharing, I became very good at sitting and your body adapts to the conditions that you put it in. And so this is so enlivening. And how I initially found out about you were these amazing videos that you share on YouTube. And also you've got other platforms, obviously, but on YouTube and sharing some things that are very counterintuitive. But even when I say counterintuitive, the intuitive part might be there. You know what I mean? Counterculture is a better way to put it, of these exercises and these mobility protocols for resolving herniations, disc bulges, and just really helping our bodies to adapt. And so I want to ask you about this because, with the standard of care, part of that you mentioned was imaging, right? And you are out here sharing that imaging, yes, that's a valuable tool potentially, but used in the wrong circumstance, imaging, MRIs, x-rays can actually be counterproductive. Talk a little bit more about that.
They can be incredibly counterproductive. And the overuse of imaging is a well-known problem in westernized medicine, and majority of the time causes more harm than good. How could that happen? I've made videos where the hook of the video is MRIs can hurt you. MRIs can damage you. What? How is this possible? It's because of exactly what I mentioned earlier, where there are so many asymptomatic findings where there isn't a problem there and now one is created. And an important lead-in I'll have here is you mentioned the term sequestered disc earlier. So this is really important as what you brought up here. Proven in the evidence, we see that when we look at disc issues on an MRI, there's various levels of the degree of a disc herniation. So there's disc bulge, protrusion, extrusion, and sequestration. That is ranked in order of the size of it. But what majority of healthcare has done is they take the size of it and then they have replaced that with the severity of it. And those are not the same. Because in that study you found, which is an amazing study, I believe it's called the spontaneous resorption of a herniated disc, they found that the greatest size of a herniation has the highest chance of recovery of all of them beneath it. So the mistake here, now leaning back into why is imaging bad, is because I could have a very normal low back pain experience. It could have been a week where I had a lot of stress at work, poor food as a result, poor sleep as a result, poor relationship at home as a result. And I've also been moving poorly the last 6 months, let's say. And in that particular week, I'm going to have a common low back pain experience. So I get low back pain. And let's just say in this scenario, if I did absolutely nothing and I did not worry about it, let's say it would have been completely resolved within a week, which is a majority of low back pain. But because of now the societal narratives and my belief about back pain, I go, oh no, I have back pain, something is wrong. So the first person I go to is my general provider, which is the wrong person to go to. They are not trained in lower back pain. It's like going to a dentist for an eye problem. It is the wrong provider, but that's the only thing they know to do. So they go to the general provider. What happens 90% of the time, more than 90% of the time, seeing a general provider? They do the only thing they know because they're not trained in back pain, which is here's your muscle relaxers, here's your anti-inflammatories, here's your pain medication, here's your script for an MRI. So then you go and get an MRI. Now, what they see on the MRI is a disc issue, but that disc bulge or herniation or sequestration could have been there for the last year and not caused any problem at all. But because the circumstances in their life that particular week triggered their symptoms, triggered the manifestation, the straw that broke the camel's back, literally. Now they're going and seeing a physician for this, getting an image, and now they're being told the reason for all this pain is because of this disc, and this disc is not only there, but it's a really bad one. This is such a bad disc. It's the worst I've ever seen. And now something that would have been a normal low back pain experience is now feeling like the end of someone's life. Oh my gosh. The worst they've seen. They told me it's a massive disc herniation. I've heard about these. My grandma Susie was using a walker for the last 10 years because she had back issues. And now you're afraid. And now you're being pushed to injections. Now you're being pushed to surgery because of what the MRI says. When in reality, once again, if you just never got the image, majority of the time, that person would be completely fine. That's the issue with imaging.
Powerful. This speaks to the power of our minds and the psychosomatic aspect of this as well. And we cannot discount, there's so much data on this now. We know this just throughout history, of course, but there's so much data on the impact of our mind and our beliefs. So again, seeing that MRI, even as you mentioned, so many people getting an MRI done and having, 50% not having any pain, but seeing, oh, I've got a back issue, it's much more probable that you will start to feel some symptoms.
It's mentally paralyzing. Once again, you might have a little bit of pain, and then you get that report, you read the scary words, you get the wrong provider reading you those words.
Yeah.
Then all of a sudden you're tiptoeing out of the office. You're moving like Frankenstein. You're a robot. What does that do? It only makes your situation worse. And to add on to this, once again, you brought something to my mind here, is there was another great study. I don't remember the name. I don't remember the year, but they analyzed the amount of imaging studies that were conducted amongst healthcare in 1 year, and then draw a correlation to the number of surgeries and injections done within that year. And what they saw is there's a direct relationship with the number of MRIs that are done and the number of surgeries that are then performed, directly connected. So more MRIs, more surgeries, less MRIs, less surgeries. If that doesn't prove it enough, then I don't know what else does. If surgeries were indicated, then those would remain constant, independent of the MRIs conducted. But it's not. They slide with each other.
Of course.
Of course.
And what you're talking about as well, that it's the nocebo effect.
Yeah.
Right? It's the nocebo effect, having a negative injunction, especially how it's communicated, with those scary words and the scary framing. And every day, like millions of people are seeing their physician, and they're essentially, their minds are being, we have like an inception scenario, and these false beliefs about our potential to heal. Now, there is a place, of course, for back surgery,
yes,
but we're talking about on an extreme. The
yes,
vast majority of people can do so much to resolve their pain without anything invasive. But here's the thing, and this is why so many people come to you, is like, when you're in pain, you want a solution. Mm-hmm. You want to feel better now, because pain takes over your life. You start to see life through this prism of pain, or there's like a fog. And so let's talk about some solutions. And of course, we're going to put resources and links to everything so people can get access, because I know that there's some people in pain right now who want to find a solution. And what I really came to connect with you on was the fact that you were sharing these different exercises that are science-backed, but also, again, very practical, simple things that the vast majority of us can do at some level. That's the thing, too. You have progressions for certain exercises. And I want to talk about dealing with sciatic pain. What are some of the things that people can do to, and again, we're obviously, if you're listening to the audio version, pop over to YouTube. We'll be putting up some of these videos. You could see them for yourself as well. But can you describe some of the things that we want to do to help to resolve sciatic pain? But first, what is sciatic pain specifically?
Sciatica is a general term that refers to pain traveling down the back of the leg following the track of the sciatic nerve. Your sciatic nerve is comprised of multiple nerves in your body, from the lumbar spine going into the sacrum, that branch form one nerve. This is the largest nerve in your body, of a diameter of up to 2 centimeters, and goes down the back of your leg all the way down and branches into your toes. What the most common connotation of sciatica, you would say sciatic nerve pain, becoming a little bit more specific there. This is typically going to be the sensation of a burning, electric shock-like sensations, or a tight rubber band pulling-like sensation. Some people will say, hey, I don't have pain, but I just can't extend my leg. It feels like there's a tight rubber band back there that's about to snap. And, I've been told it's a muscle. How long has it been going on? Months. Okay, do you have any back pain? Yeah, sometimes. That's not a muscle. That's your nerve. So that's the background of the sciatic nerve. And so what typically causes sciatica? What could cause this nerve to radiate down the back of the leg? The most common cause is disc bulges, is a disc bulging out and hitting that nerve directly. Later in life, typically above the age of 65, something called stenosis can also cause sciatica, which is where the holes in your spine that the nerve passes through become, there's bony overgrowths. It becomes more and more narrow, and that can start to encroach on a nerve, which can also be conservatively managed a majority of the time. But that is a subgroup of things that can cause sciatica. Number one cause, disc bulging and hitting a nerve. So in that situation, it's very important that we just addressed what is causing it. Majority of the time, disc is bulging, hitting the nerve, causing the sciatica. So what is the root? The disc. The disc is the root. But because majority of healthcare is very poor at treating lower back issues and their assessment of these things is very poor, wherever that person is stating their pain is located, that's where they look, because they don't conduct a good assessment, a good history, a good evaluation for these things. So when you experience sciatica, you're typically experiencing the symptoms in your glute, in your hamstring, or in your calf, not in the lower back. You can have both. You absolutely can have both. A ton of people will have back pain that is also radiating down the leg, but many people might only have pain in the leg. So if someone says, oh, I got back pain and I have a bunch of pain in my glute, or I got some back pain, but oh my gosh, my hamstring is so tight, it's burning, it's on fire. The vast majority of the time, they go to a general provider or other, PTs or chiros. And so what are they doing? They're doing hamstring stretches, which can make it worse. Pulls on the nerve, pulls on an irritated nerve. If you imagine that disc is the thing that's hitting it, causing it, if you don't get the disc off the nerve, you're just pulling the nerve across the disc over and over and over, and it can make it worse, and does a majority of the time. Or they're at the clinic and they're just doing scraping or acupuncture or massage where that person is feeling the pain. And it might feel good in that moment for many reasons, but those results do not last because the problem is not in the leg. The problem is in the lower back. Sciatica, majority of the time, but depending on the cause, is a low back problem, not a leg problem. The leg is where you're experiencing the pain, but the low back is where the problem is. So we need to get the disc off of the nerve. How do you do that? By focusing on the back, by doing the movements of the spine that can help the disc resorb, that can accelerate that process that you mentioned earlier, that can help load the disc back where it came from. Now, what is that? Vast majority of disc issues are deemed flexion intolerant. What does flexion intolerant? Flexion is forward bending of the spine. So anyone listening, imagine you're bending forward to touch your toes. That is flexion of the spine. Intolerant, that means does not tolerate. So your back, your disc, does not tolerate forward bending motions. So for individuals who might be listening to this or might have sciatica, most it will experience these following symptoms. Most will notice the longer they sit, the more pain they feel. When they bend forward, like putting on their socks and shoes in the morning, the more pain they will feel. Or if you have been sitting for a long period and you go to stand up straight, it's like hard to stand up straight when doing so. These are signs of flexion intolerant lower back pain. So we've established bending forward, sitting forward, forward motions does not feel good. Why is that? It's because what it does is it puts additional pressure on the backside of the disc, the portion that is bulging. So it further bulges the disc. It puts more pressure where that injury or that weakness is, thus putting more pressure on the nerve. So what that person should not be doing is more forward-based things. They should not be doing more things that involve pushing that disc further or stretching that nerve further, which is what a lot of people are doing. Yeah. They're doing the hamstring stretches. They're doing the forward bending stretches that simply exacerbate their symptoms, and they're frustrated and don't know why. What they should be doing is the exact opposite. So if forward bending motion, sitting in a forward position is increasing symptoms, we know that going one way increases stress. So let's do the opposite way to reverse the stress. So we need to do more of what our low back is not getting. which is extension-based movements, getting out of the seated position, going the opposite direction into extension-based motions. These are the types of motions, a majority, and in different ways, in different frequencies, in different dosage, and different modifications. This is where the magic comes in from our standpoint as the clinician. It's not a catch-all fix, but that direction is going to be the direction that a majority of issues can resolve their disc bulge, thus resolving the sciatica.
Amazing, amazing. So what are a couple of exercises for extension?
Yep. Super simple examples. Imagine a typical cobra pose like in yoga. You're laying flat on your stomach. You're pushing your chest up off the ground into an extended position. And then I'll add in some additional tips here. The reason why a moment ago I said, hey, extension, but there's specifics and all this. A common example, if you type in disc herniation exercise in YouTube, you will see this cobra pose in so many different videos, mine included. You'll see it all over. But if a majority of individuals have a yoga background or they're listening to other random videos, common things that people will do is they will squeeze their glutes or they'll squeeze their lower back while they're performing the motion because they are thinking in their head, I need to be using muscles to perform this exercise. No, that can make the exercise painful for many people who have disc bulges. So they might look this exercise up, try it, do it the wrong way and think, oh, I don't respond well to that. I hear this Grant guy talking about these, but those don't feel good to me. You might be doing them the wrong way, the wrong amount, the wrong dosage, the wrong progression with where you're at. So for that example, you want to keep your lower back and glutes totally relaxed, just pushing to the point of tolerance, ensuring that you're not increasing symptoms down the leg, but doing this repetitively, not holding it repetitively. Discs love repetitive load, not a static push. They love repetitive load. It will slowly work the disc back in to tolerance. So I wanted to add in that these specifications can completely make the difference. It can take an exercise from making someone worse to making them better, even though it's the same movement. Other examples of extension exercises, there are many. I could just stand up out of my chair and I could stand up and lean backwards a few times to take a break from my chair. I could get in a hip flexor stretch like position, get my hip nice and behind me, leaning back into it. That would be totally fine as well. I could start performing more glute bridges. Glute bridges does put the lower back into extension. However, it does increase tension in the glutes and lower back. So depending on the person's tolerance, that may or may not be helpful considering their situation. So anything that is getting that person's low back arched, going backwards, but without significantly increasing muscular tension, that is the ideal extension movement.
Amazing. So with this extension, so you mentioned repetitive. So is there like a certain amount of time? Like if we're pushing ourselves away from the ground, we don't want to hold it for say 10 seconds. We want to maybe do 10 repetitions of a couple seconds. Is that accurate?
Correct. Yeah. There's typically, and once again, I want to be so clear here. It's always situation dependent.
Yes.
Always, always. The manner in which I'm speaking in any show and in any video, my goal is to apply to the masses. It is impossible for me to say one thing that applies to every scenario. That does not exist. So a majority of people, it's best to maybe only hold it a second, maybe two, but to get more repetitions. So if someone were advised, hey, do cobras for a minute in the morning, a minute in the afternoon, a minute at night, let's just say, it would be far more advantageous for them to do it repetitively for the entire minute than hold it for the entire minute. You should use the time allocation for repetitive motions.
Got it. Now, again, these are just some of the foundational exercises. You share so many because, again, it's situation dependent, arming ourselves with a bunch of tools. So we have those weapons in our superhero utility belt if we need them. And a big part of this, I would imagine, once we can get ourselves out of pain, and by the way, we'll just say, somebody has an onset of pain, right? And their body's kind of, freezing up and they're very tense and they're not really feeling like they could do much of anything. But we'll say 24 hours goes by, they feel a little bit better. Is this a time for us to start moving? So yes, doing some of these mobility exercises, but is there anything else that we should be having our eyes on? Maybe even just walking? Like what are some other things for us to do as soon as we can do it?
Yeah. So you want to do as much movement as you possibly can within your limits as early as possible. And this applies to any musculoskeletal injury, but especially lower back pain. So we talked a lot about how rest is not helpful previously. And all the same evidence that has found that rest has not been helpful. The number one thing that anyone can do when they do have an onset of lower back pain is, at the best of their ability, maintain normal everyday activities. They might not be able to do everything perfectly. They might not be able to do all of their normal activities, but maintaining as much of your normal activities as possible is the best piece of advice, instead of the opposite of pulling everything back. So the simple answer to your question is, as much as you can do without significantly increasing your symptoms is what you should do. Maintain as much of your normal life. Now, if someone is not walking, let's say walking is not a part of their normal everyday life, which it should be, you should be going on at least a 10-minute walk in the morning and at night. It's so important that's actually integrated into our program, changing someone's lifestyle that will last after our program is over, instilling simple habits. That's good for a multitude of reasons. But let's say someone is like, okay, well, I have pain. Walking is not a normal everyday activity. I don't know if I should do it. Walking is a very powerful tool to get someone moving to some capacity. So if they're afraid to do other movements and they don't have any guidance, doing some movement is better than no movement. So try. Go on a 5-minute walk. Are you okay? All right, now try for 10. Are you okay? All right, now try for 15. Hey, 15, that flared me up a little bit. Okay, but 10 was okay? Yes. All right, stick at 10 and then go to 12 and then go to 14. And then, okay, now you can break 15, sweet. Now go to 20. Whatever amount of walking you're able to do, whatever amount of movement you're able to do it. But walking is a powerful tool.
I love it. I love it. Are there any go-to stretches? Let's talk a little bit about stretching, static stretching versus more kind of mobility work. Is there a place for stretching? Are there any stretches that you really like for low back pain?
Well, the term stretch is difficult to talk on because there's semantics about that. One person could say the word stretch and they might mean something different from another. So some people, when they refer to all of my videos, they refer to my videos as stretches. I would not call my videos stretches, but I also would not say someone is wrong for calling them stretches. So there's a lot of semantics here. So when I say the word stretch, typically what I'm referring to, the connotation that I would assume, is someone, let's just say, sitting on the ground doing a typical static hamstring stretch. That's the connotation. That's focusing on just putting a muscle in an elongated position for as long as I'm able to, with the goal of increasing the elasticity of that muscle. That's the connotation I have with the word stretch. With the majority of the movements that I show, they're focused on the joint. I do show strengthening movements for the muscle, but I don't really have any videos or any substance that's focused on getting your hamstrings looser, getting your hip flexors looser, because the evidence does not support those notions for the cause or cure of lower back pain. I focus on what the evidence shows and I focus on what works. So to get back to the base of your question, static stretching, what stretching do I advise, what have you? Joints love repetitive motion, discs love repetitive motion. So if someone is dealing with a lower back issue, majority of the time, that's not going to be from a tight muscle. That's not going to be the association. Normally, it's going to be disc or joint. So a majority of the movements should be repetitive movements that are mobility based of the lower back. And there's so many different things you can do. And depending on what the issue is, you might want to do mobility one direction and not the other direction, right, as I already stated. But for most people, if they're doing these long static holds and they're noticing it's not working, well, then you're doing the wrong thing. Results should be very fast if you're doing the right thing. Or if they do have a sciatica issue or a disc issue and they're doing a lot of forward-based bending or other static stretches, that it should be evident that that is not working for you either. So stretches and movements in general that involve movement are going to be the best. Yeah.
And of course, I know what the answer is already. It's going to be, if we can get these inputs in, if they feel good, of course, but what are the different inputs that our body's expecting from us? So this might be a 90-90 stretch. This might be rotational stuff, but we want to integrate, especially if we can get ourselves out of pain, integrate these things on a regular basis as well, because it's not just which you're a master at, which is helping people to get out of pain, but it's helping us to prevent pain in the future, right? And so what are those inputs that our body is missing? And what is your perspective as far as like, you mentioned strengthening as well. So what is your perspective on, you mentioned a glute bridge earlier, right? So this might be something to help with extension, but is this something for us to practice to maybe strengthen certain muscles? What is your perspective on that as far as like training, strengthening to prevent pain in the future?
So you have back pain because your core is weak. That's a myth. Your glutes are weak. That's why your back hurts. Strengthen them and you'll feel better. That is a myth. But what is not a myth is we can't go wrong being strong. And a majority of the population is not strong enough. And being strong is exponentially more important the later in life we get. So it is important to be strong. I'm very passionate about being strong, helping other people to be strong, to be fit. But when it comes to the treatment of lower back, spine disorders, disc disorders, sciatica disorders, strengthening a muscle is not the focus. It's not the focus for them because it's not related to the actual root of that problem. So it's very frustrating when these myths like weak core and weak glutes are being perpetuated. So is it helpful to have a strong core? Sure. Is it helpful to exercise? Yeah, I put those in the same category. But we don't want to have people focusing on the wrong areas or being convinced that their pain is so simplistic when we know it's more complex. We want to make it simple for them. We want to make the solution simple. But if we convince someone the reason for your 6 months of low back pain is your weak glutes, when in reality, they've had poor movement habits for the last 2 years. They're extremely stressed. Their belief system around back pain is very, very poor. There's other psychological components that they need to get treatment for. We're discounting all of that. And we're just saying, yep, it's just your weak glutes. It's incredibly disrespectful to them and to how to actually address lower back issues. Now, the approach for muscles in general, many people, a muscle will feel tight when it is weak. So a tight muscle is a weak muscle. Everyone's doing these hamstring stretches and hip flexor stretches, but not training them at all. So if you've had tight hip flexors, I got tight hips, and you've been stretching them for 6 months and they're still tight, I don't think that's working. I don't think it's because they're tight, and I don't think you're loosening them at all. Train your hip flexors, train your hamstrings, load the muscle. That will promote a much better adaptive response. But the sequence of these things is important. As I stated, if someone has a lumbar spine disorder, we're focusing on strengthening these things later. That comes later. Step 1, let's get the disc off the nerve. Let's get your nerve pain gone. Let's restore your mobility. Now let's move to a bulletproofing stage where we're loading the joints, loading the disc, loading the muscles much greater than someone could when they're in pain. These are separate phases. Get pain-free, then get bulletproof. Not, I have a lot of pain, let's work on arbitrary muscles that we think are related to your disc, which aren't, and then prolong the process and cause more confusion.
Amazing, amazing. Are there any other misconceptions, myths about the cause of back pain, like loss of curvature, or, you've got one leg that's longer than the other? Let's talk about some of those things.
Absolutely. And I will prephrase this conversation with saying, this is not my opinion. This is the evidence's opinion. So I'm just being a middleman here. There is no conclusive evidence that shows that different arbitrary opinions of what is a good curve or bad curve are causing back pain. There is no perfect curve that's just created. Like, why is my spine not supposed to be curved or supposed to be more than it currently is? That's the way that I was made. So a common thing that people will hear is, it's usually chiropractors in this particular instance, which is outdated, not evidence-based, is I was told I'm losing the curve in my neck or I'm losing the curve in my lower back. So our focus is restoring that so I can feel better. Okay, well, the treatment that they might be doing for that might still be helpful treatment for what you're going through, but the narrative is incorrect. There's no conclusive evidence that shows loss of low back curvature or neck curvature is causing pain. There's zero proof of that. And in fact, if we look at majority of evidence, we know majority of the population has some degree of abnormalities. I don't even like that term because it's arbitrary.
Right.
Most people have some degree of scoliosis. Most people have some degree of asymmetry. And these things are completely normal. And that applies to, I got uneven hips. I have uneven legs. Well, great. That means you're normal because the majority of the population has uneven legs and uneven hips. The only time something like uneven legs can cause a problem is when the difference is greater than 2 to 3 centimeters. That's a huge difference. That's a very big difference. But 90% of the population does not have even legs. That's normal. Another thing is pelvic tilt. I have anterior pelvic tilt. I'm arched forward all the time. I was told that needs to change. I need to get my pelvis neutral. Not true. 90% of the population has some degree of anterior pelvic tilt. That is a normal structural observation. There's so many myths surrounding these things. When we want to find these simple explanations to say, this is the one reason for your pain. When in reality, if we forgot all the explanations, if we removed all diagnoses, if we removed all simple approaches, and we just told everyone with low back pain, this is common, you'll be better, just move more. The amount of back pain would hit the floor, and it would probably not be the member with disability anymore.
Yeah. Yeah. What this really, if we are to put a label on what this is when we're lacking movement and we're doing marathon chair sitting, and that's just who we are, that's a part of our lives, it's just a tremendous stressor on the body to not be mobile. And stress really speaks to a potential activator of a lot of these different issues. There's a variety of stressors. I love that you've been pointing us back to there isn't this one thing. If I just fix this one thing, then my back pain is going to go away. Because our bodies are not just operating in a vacuum, this little part over here, this little part over there. But being that stress is a more encompassing way to look at all this stuff, can we talk about the impact of stress? Because when we think about stress, we tend to think about psychological stress, but there's physical stressors, there's environmental stressors, there's emotional stressors. Can you talk about the role of stress when it comes to back pain?
Yep. So I will give two, a physical stressor and an emotional stressor. And these are completely true stories. I have a very good friend of mine. He's a very high level person, super A-type. Every single day, this dude's, running multiple miles, going to jujitsu, crushing the gym. He's like, I don't even want to sleep. I just want to work. That's my type of guy, truly. But this guy does not slow down. And he has aches and pains very frequently. And very frequently, he calls me, hey, man, my back's hurting again, or this is hurting. What should I do? And I've known him long enough that now every single time he calls me, I say, you need to deload. What does that mean? Deload. It means lower the amount of load they've been placing on your body. He is a chronic overstressor from a physical standpoint. He's a load management case. So for that, he's outputting way too much, inputting way too little. So he's not eating enough. He's not sleeping enough. He's not meditating. He doesn't have things that bring his system down. Only things that are bringing his system up. So he's always having these flare-ups. So that's an example of an overstressor from a physical standpoint. In that scenario, I'm not telling him to rest. I'm telling him slow down or do more of nutrition, do more of meditation, do more of things that slow you down to get that balance. That's that example. Other example is we had a client in our program. Her name's Gabriella. I'll remember this story forever. This was a scenario where she had a symptomatic disc herniation. It was very obvious. We did give her a specific plan for that disc to regress it. This woman was, afraid for her life essentially, and we had her completely pain-free within 2 months. Completely pain-free, back to normal activities. We were phasing her into the bulletproofing stage, which is an essential component. And she's doing great. Every week, yep, great, yep, amazing, everything's fine. And at this point, it was let's keep going. And then one day, we get a message from her. And it's, all my pain is back, something's wrong, this pain is shooting back down to my leg, I re-injured myself. Just the worst message you could imagine coming from such a success story. And so what's really important is we didn't immediately go, okay, let's try these exercises now. Okay, what movements did you do? Instead, the simple question we asked was, have you changed anything from what you've been doing the last month? No, I haven't changed anything. Same routines, everything's the same. Okay, so then we couldn't have re-injured this. There's something else going on. So we get her on a call, joins the call. She's crying. I hurt my back. I know I had to have done something wrong. We asked again, Did you change your exercises? Did you do anything outside of the plan? Did anything in your life change? No, no, no. Okay. So first, step one, if you weren't in a car wreck yesterday, if you didn't have a massive fall, if you didn't try to deadlift 500 pounds, you didn't injure anything. Okay. Realization number one. All right. I obviously did not succumb to an injury. Why is my pain more? Okay, so that was step one, understanding that. Hurt does not equal harm. Just because you feel pain does not mean an injury has occurred. Very important. So that was realization number one. Two, okay, well, if I didn't do anything, then what's going on? And we just simply asked, what else has happened in your life recently? I don't know, just normal things. Okay, has anything changed with work? No, work's been the same. And then I asked her, at the time I was the one working with her. And then I asked her, has anything personal in your life happened recently? Anyone to a family member or anything happened to a friend? And it was silence for like 5 seconds. She goes, my best friend just died 2 days ago. I said, okay. I had a slow and careful conversation about how much that is relating to your experience and how when we succumb to a very high degree of stress, emotional stress, what your body will do is it will find an outlet for it. And if you have a somewhat recent or even a long time ago, an injury that had a significant impact in your life, it will use that as an outlet. It's a way for your body to try to get that out of your system. It's real.
Yeah.
So I had that discussion with her and explained your timeline directly relates to this massive increase in emotional stress due to this. You did not fall. You did not do any lifts yesterday. Nothing is injured. Your body's using this. It's overloaded. It's using this as an escape. Just having that conversation of those two main components, her getting educated on pain and understanding that hurt does not equal harm, and then understanding that this timeline directly relates to the passing of her best friend, within 48 hours, completely pain-free, completely back to the way she was prior to the incident. And then she continued on completely successful, absolutely no changes in her since then. And these are real things that happen all the time. And having this understanding and this nuance is incredibly important.
Yeah. You're one of the people that's helping, again, to reestablish the truth, which is there isn't a mind-body separation. You know, they're all existing in one entity. And, you know, our minds are very, very powerful. Every thought that we have changes the chemistry in our bodies, you know, and so whether this is neurotransmitters, hormones, certain enzymes, everything's being affected. And when we get into a heightened state of stress, especially again, if we have a past injury, you know, there can be referral pain to where something is getting activated, even though this other thing might have happened. And our bodies are intelligent, and they're usually giving us very clear messages that in our modern society, if we're not listening or trained to listen and to slow down, just pay attention to that feedback, we can find ourselves just digging ourselves into a deeper and deeper hole. And so thank you for that, because all of this stuff matters. And you mentioned your programs that you have available. And can you share a little bit about that, how people can get access, get more information?
Yeah. So we have a massive online program. We're the number one online program in the world. And we see people literally anywhere in the world. In a given week, we'll talk to people in Australia, New Zealand, Saudi Arabia, anywhere. And what we do is we provide people access to the highest degree of care for back pain that they cannot find access to otherwise. So we're meeting people over Zoom. We're providing in-depth evaluations, going through these types of conversations, giving people the time that they deserve. Instead of a 2-minute in and out, here's your drug script, we're giving the time that people deserve, the evaluation that they deserve to determine both components of, from a mechanistic standpoint, okay, what are the movements that trigger your pain? What are the movements that reduce your pain? Let's form a rehab approach that is step-by-step and structured for your exact situation to tell you exactly what you need to do to get out of pain so you can stop guessing on your own, as well as including, to the degree that that person needs, the mental and psychological resources that can handle that component as well. So that is dependent on the extent of that person's situation. Some people will be less mechanical, more other. Less other, more mechanical. It's not a matter of if there is a mental component of someone's pain, it's just how much in that given person. So throughout this conversation, and I know you asked me about my program, and it's an opportunity for me to plug that, and I did it a little bit, but I really want to harp that I know we've talked a lot about beliefs and stressors and all this. That is a huge component that is not discussed enough, but by no means am I discounting that all we share is exercises primarily for low back issues, and there are going to be specific movements that people need to resolve that component of it. We just don't want to neglect the most neglected area, which is all this other. So we will provide you a specific rehab plan, giving the exact exercises to do, the exact exercises not to do, and then all the education on that component and all the other components that are necessary to complete the picture for that person so we can get them pain-free as quickly as possible, and then bulletproof, back to all the things they want to do. And if I can lead this into another subject matter, that bulletproofing component is so important because so many people, when they just get out of pain, it's kind of like they're thrown to the wolves from the typical healthcare system.
Right.
Meaning it's kind of easy to get someone out of pain. Like, hey, if you just want to give someone some oxycodone, you can get them out of pain. Not suggesting that as a proper treatment approach. But what's important is when someone starts to get out of pain, having a plan to get back to all of the activities they want to do. And yes, it is possible to get back to running, heavy squatting, deadlifting, training, Ironmans after back pain. It absolutely is possible. Anyone who's telling you otherwise should not be in healthcare or not be talking to you. So having a bridge from I'm in pain now, how do I get out of pain? But then how do we get you back into the gym or your designated activities and ensure that your spine is strong and stable in all ranges of motion so that there isn't anything that life can throw at you that your back can't handle? That is a crucial component.
Yeah. So where can we get access?
At RehabFix on all platforms. YouTube obviously is where you found us, popular resource. Instagram is definitely our number one source for all of our clients around the world. We also have our website, therehabfix.com. But our Instagram is the place to get us. And for all those listening, I did want to provide something to your audience, if that's okay. If you go to our Instagram and you DM just the word podcast, that's going to tell us you listen to this. We're going to send you something. I created a very, very in-depth evaluation. There's a full 1-hour assessment that we take our clients through prior to joining our program to help diagnose them real time, determine what's causing their pain, and the initial exercises that they should do for that to fix it. And I created a video that maps out this process that people can basically go through our assessment on their own and will get somewhat of a diagnosis from me and initial steps that they can take from this video that they can immediately apply, that I don't have this shared anywhere else, that's not accessible anywhere else, and that can give them some immediate relief. And if they want more help from us, there will be the opportunity for them to do so, to meet with us one-on-one and to get that coaching.
Fantastic. Thank you for that. So what is the Instagram again?
At RehabFix. RehabFix. All platforms, message us the word podcast.
It's phenomenal. This has been, again, a masterclass. I've got the right person here to help us to enlighten this subject matter. And if you could, final question, what is the model that you're here to create for your family and for your community with the way that you live your life personally?
Oh gosh, it would be difficult for me to summarize, but I would say the principles that I try to live by the most would be what I try to model. And what I try to model is do what I say I'm going to do. I seek out hard things, and I have to always be growth oriented. And if I'm not pursuing growth in some category, then I am losing. So I would say those are how I want to model.
Amazing. This has been amazing. I mean, I don't even know what else to say about it. This is so important today. And thank you so much for saying yes to this mission and creating all these resources for everybody. And, this is the right use of technology. You having the audacity to I'm going to post every day, and then finding that superpower basically and helping so many people is just, it's priceless. It's priceless. So thank you again for coming to hang out with us. And I look forward to connecting much more, man. This has been awesome. Thank you.
Thank you so much for having me. I'm extremely passionate about this. We love changing lives, and there's nothing more I'd rather be doing.
Hey, if you like this video, make sure to check out this video right here.
When I was in my mid-30s, man, I was having all kind of knee pain, back pain, shoulder pain. And then when I learned how to train properly, I started jumping higher, feel good. I literally can wake out of my bed and run and dunk.